Welcome to our keynote session. I'm going to kick it off by introducing Aliyah Collins, who is one of our amazing planning committee members for the Taking Me to Your Black conference. We are so excited to have her provide the introduction for Dr. Sheats, as she has also been working in the environmental justice and mental health space. Aliyah Collins is a young climate advocate residing in Chicago, Illinois, a square mile manager with an environmental justice organization called Blacks in Green. Her work in the environmental justice space began when she was a student at Fisk University researching eco-womanism. She later founded her own climate justice project called the Eco Healing Project, which supported HBCUs in building gardens on their campus. Aliyah received a Master's of Divinity degree from Harvard Divinity School, where she served on the Harvard Climate Change Conference Committee and presented her work on the environmental justice on HBCU campuses at the first annual Harvard Climate Action Week. Thank you so much for joining us, Aliyah, and I'll pass it over to you.
Thank you, Jymani. I really appreciate it. I've enjoyed being on the planning committee, and I'm so excited about this keynote to talk about really the impact of mental health and its intersections with the climate crisis. So excited to introduce Dr. Jylana Sheats and her amazing work. Dr. Jylana Sheats is a behavioral scientist, public health leader, and scholar dedicated to bridging science, society, and equity. She specializes in designing solutions that drive behavior change, improve health outcomes, and address complex societal challenges. Drawing on her cross-sector experience, she brings a collaborative, innovative, and community-centered approach to advancing health equity and addressing disparities. Dr. Sheats is an associate professor and course director for social innovation at Tulane University Cecilia Scott Weatherhead School of Public Health and Tropical Medicine, where she trains future public health and healthcare leaders to approach challenges with creativity, equity-centered strategies, and systems-level thinking. As Associate Director of the Aspen Institute Science and Society program, she provides strategic guidance to strengthen the scientific ecosystem, ensuring science serves the public good. Her work as a senior science advisor spans critical issues such as food insecurity, clinical trial participation, health plan utilization, and the mental health impacts of climate change. Applying her expertise as a behavioral scientist to the intersection of health and climate change, Dr. Sheats advises organizations such as the Climate Mental Health Network and previously collaborated with Black Tulane, a San Francisco Bay Area nonprofit promoting ecological stewardship and community healing. Her work bridges research and practice exemplified by the 2021 landscape analysis and report on youth climate mental health, which informed the development of a resilience framework and resilience hub to address climate anxiety, particularly among Gen Z youth of color. This project and recent studies continue to guide the creation of digital and non-digital curricula and tools and thought leadership to help youth educators understand, recognize, and manage climate-related emotions. Known as a boundary spanner and for amplifying diverse voices, Dr. Sheats builds trust and transforms ideas into actions that drive equity, sustainability, impact. She holds degrees from Spelman College, shout out to the HBCUs, Tulane University, and Indiana University Bloomington. And she completed a postdoctoral fellowship at Stanford School of Medicine. Help us welcome Dr. Jylana Sheats.
Thank you so much for the warm welcome, Aliyah. Hearing that made me realize that I need a shorter bio, and I apologize for you having to read all of that. But what excites me about you introducing me is that I come from a family of Fiskites. Fisk is very important to me, and I consider it my first HBCU, as that's where my parents met, and my twin brother went there and is on faculty at Fisk. So I love that. But good morning, everyone. I'm Dr. Jylana Sheats, and I'm honored to be here today for this conversation on climate change, mental health, resilience, and hope. I serve, as Aliyah had mentioned, as a clinical associate professor at Tulane University. And I won't go into all the other background because you've heard that. But throughout this talk, I'll share insights from my work and research, but more importantly, we'll explore how we can collectively address the mental health impacts of climate change, because this isn't just an individual issue, it's a systemic one. So I come to you from my office in Nashville, Tennessee, the city in which I was born and raised. Before my family and I were even a thought, the ancestral lands that I stand on, or in this case, I sit on right now, are of the Cherokee, Shawnee, Choctaw, Chickasaw, and Creek peoples. This land carries a long history of Indigenous stewardship, resilience, and displacement. And while history often focuses on what was taken, it's just as important to recognize that Indigenous communities are still here. They're protecting their lands, cultures, and futures. And so as we discuss climate, justice, and mental health, acknowledge that Indigenous knowledge has long guided sustainable practices. The land itself holds wisdom passed down through generations of caretakers. So let's let this acknowledgement not just be words, but a moment to reflect on how we honor and support Indigenous-led efforts to protect the environment and ensure climate justice for all. As Aliyah said, I am a behavioral scientist, and while a portion of my educational background is in psychology, I am not a psychologist. I study health behaviors within the context of public health. And climate change is very much a public health issue. Mental health is a public health issue, yet far too often these fields are treated as separate, when in reality, they are deeply interconnected. And so I had all these plans to talk about the things that I've done, but I won't go into that because you've heard it all. But my work in climate has been in partnership with the Climate Mental Health Network, Sea Change Institute, Black to the Land, Thriving Earth Exchange, and NEAF. And last fall, alongside colleagues from Stanford University, as well as community partners that I worked with and that they worked with, I was able to co-author a book chapter on community-based approaches to climate mental health. And I'll share a little bit more about that later on. Before we begin, I want to step away from the urgency of the crisis, from the reports, from the policies and the numbers. And instead, I invite you to take a deep breath. So close your eyes if you're comfortable. If not, just soften your gaze on a point in front of you and let your shoulders relax. You spent the last day or so hearing about the climate crisis. You've heard about resilience, solutions, and the ways our communities are fighting back. And I know that even solutions can feel heavy sometimes, and even hope can feel exhausting when the stakes are this high. So before we go any further, I'm going to take us somewhere else. So just hold tight. Picture a place where you feel whole, a place where the land holds you, where the air is fresh in your lungs, where you're not fighting, you are just being. Maybe it's a childhood memory, running barefoot in the grass, the scent of the earth after rain, the hum of summer air. Maybe it's a place you've never been, but one that you can imagine, a place where our people are thriving, where clean water flows freely, where the trees stand not as witness to harm, but as shelter, a sanctuary. For some, land has not always felt like a safe place. It's been stolen, denied, and even weaponized against us. But this land, the one that you are picturing now, is different. This is the land where you are free to roam, you're free to breathe, and more importantly, you are free to rest. A land that does not ask us to prove our belonging because we have always belonged. Now, as you hold this place in your mind, I want you to notice what you feel. More importantly, how you feel. Does your breath feel easier? Does your body feel lighter? Even in this imagined space, you might feel weight, uncertainty, grief, or urgency. These emotions, relief, fear, hope, and exhaustion, are all part of the climate experience. They aren't signs of weakness, they're signals. They remind us of what's at stake, what we've lost, and what we must protect. Whether it's anxiety about future, grief for what's already gone, or the determination to protect what remains, these feelings aren't just personal, they're shared. They show us that we are connected, that we care, and that we are paying attention. Let's refocus and take a deep breath. Know that whatever emotions you carry, you are not carrying them alone. We are here together, not just to feel, but to find ways to move forward. So when I was writing this talk, this is the image that came to mind. Although you see more of him than me, this is a photo of my twin brother and I outside of our childhood home. playing, exploring. We are completely immersed in the world around us. Back then, nature wasn't just something separate. It was part of how we moved through life, how we learned, and how we connected. At its core, our relationship with the environment is deeply personal. It's about memories, experiences, and emotions that are tied to them. And that's why climate mental health isn't an abstract issue. It's about people, it's about our stories, and the ways that we navigate the world that is literally shifting beneath our feet. And so today I will talk about how climate change and environmental justice impact not just our surroundings, but also our mental health and well-being. And so to understand the disproportionate impacts of climate change on Black communities, we must first start with history. And I know that many of you are experts in this space and you know the history, but I want us to all be on a level playing field. And I hope that through other presentations this week that you have a greater grounding in this space. Black people have long been stewards of the land through agriculture, spiritual traditions, and community caretaking. Yet systemic racism has often turned these connections into sources of pain rather than peace. And as a people, this isn't new to us, okay? And in Black Faces and White Spaces by Carolyn Finney, she reminds us how historically Black Americans have been systematically excluded from outdoor spaces. Parks and natural reserves, which are spaces that are intended for healing and recreation, were segregated. And today that legacy persists with many Black individuals reporting feeling unwelcome or unsafe in outdoor recreational spaces. And these injustices have had lasting implications and continue today. I grew up in a household where my father loved the outdoors. He loved gardening and he really loved being near water, but he never learned to swim. A consequence of the institutionalized racism and discrimination he experienced growing up in the South in the 40s and 50s. And so anytime we were near water, which was often, I carried this persistent fear for safety, even though he was completely unfazed. And so that worry stayed with me from childhood into adulthood. And in many ways, I made it my responsibility to carry that concern, even when he never did. And so when I saw this headline last week about Howard University's swim team winning an NCAA championship, it felt deeply symbolic, not just for my family, but for so many others with similar experiences. Their victory represents progress, but as we all know, there's still more work to be done. Beyond exclusion from nature, systemic disinvestment in Black and Brown communities has created environmental vulnerability. And so environmental vulnerability is the degree to which a community or ecosystem is at risk from environmental hazards like pollution, extreme weather, and poor air or water quality. And so this risk is shaped by three things: exposure, sensitivity, and adaptive capacity, all of which are deeply influenced by socioeconomic status, or SES, racism, and discrimination. Exposure refers to a community's proximity or closeness to environmental hazards, and it's often dictated by discriminatory policies like redlining, which has historically placed Black and Brown communities in high-risk areas. Sensitivity refers to how much a community, an environment, or even a system is affected by climate and environmental changes. Communities with poor infrastructure, health disparities, and economic instability, often worsened by systemic racism, face greater risk. For example, neighborhoods with limited healthcare access and high rates of asthma or even heart disease are hit hardest by air pollution and extreme heat. Adaptive capacity is the ability to adjust, recover, or cope with environmental consequences. And so it's often limited by underinvestment in healthcare, education, and infrastructure, restricting access to resources that build climate resilience. Black communities face disproportionate environmental risk. And I'm going to come back to the environmental vulnerability in just a moment. And so the risk that we have is not by chance. It's due to historical and systemic inequities. You'll hear me say that a lot. You've probably heard it a lot in the conference thus far. But that is the reality. The EPA reports that Black Americans are 40% more likely to live in areas with rising heat-related deaths and 34% more likely to reside in regions with high childhood asthma rates due to air pollution. The Environmental Defense Fund highlights that counties with large Black populations experience more extreme heat days. And in the southern US, Black residents are disproportionately in flood-prone areas, increasing their risk of displacement. So, but climate justice is not just about rising temperatures. It's about who's most affected and why. And so without systemic change, these inequities will only worsen. And so given my position at Tulane University, I can't discuss environmental vulnerability without acknowledging Hurricane Katrina, a devastating, and we all know this, but a devastating case of what happens when risk is ignored. I first lived in New Orleans in 2002 as a student at Tulane, actually, and later as a working professional, also at Tulane. Katrina wasn't just a natural disaster, it was systemic failure. And for many, it's not just history, it's a warning. New Orleans is shaped by water, as we know, but not all communities were equally protected. So Black residents were disproportionately in flood-prone areas, which we already know from the last slide that is common. The levees were outdated and poorly maintained, and they collapsed, submerging entire neighborhoods. Exposure in this case would be a city, vulnerable to flooding. Sensitivity, this is where the residents, there are many residents who were older, many were living with disabilities or lacked the means to evacuate. And then there's adaptive capacity, where delayed federal aid, mass displacement, and long-term devastation exacerbated things. And so this wasn't just about the storm, it was about who had power, who had resources, and who had the ability to recover. So who had the means to evacuate, who was left behind, and who got to return and rebuild. And some communities did return faster than others. A colleague of mine wrote a book, and I can't think of the name right now. I'll have to share it in the conference app a little later, but it talks about how the Vietnamese community were the first to come back after Katrina. They united, they joined forces, they didn't mind, all grouping together and sharing a house, and they were able to rebuild. So even today, there's a large population of Vietnamese in New Orleans. However, when we look at communities like the Ninth Ward, still bears the scars of delayed recovery and broken promises. I do a lot of research around food security, and one of the projects I did a while ago focused on understanding the food environment. And what I learned in this neighborhood research was that at that time, and this was like in 2018, 2019, there still was not a full service grocery store, like a full supermarket in the Ninth Ward. Instead, there was, and I believe it was called the Lower Ninth Ward Market. And the owner of the Lower Ninth Ward Market is amazing, wonderful personality. But what I saw was that in this very small space, about the size of a convenience store, what he did with that space for the community, because it was the only resource, was that it was basically a grocery store, a hot dog stand, a snow cone stand, a barbershop. It had washers and dryers, so it was a laundromat. And then it was also a computer center, so that people in the neighborhood can come and use the Wi-Fi. And I'm sure I'm missing something else on there. But this is, at this point, this was nearly 2 decades after Hurricane Katrina, and we're still seeing these issues. Okay. And so what Katrina showed us is what happens when climate vulnerability meets systemic neglect. And if we don't change course, and unfortunately in the Lower Ninth Ward, it does not appear that it is, it won't be the last time, unfortunately. When I was conducting, some of the research in New Orleans, one of my studies was called Our Voice NOLA, with NOLA standing for New Orleans, Louisiana. It was a digital citizen science project, and one thing stood out. People in New Orleans don't just recall Hurricane Katrina, they frame time itself around it. Life is divided into before Katrina and after Katrina. After talking to community member after community member, that's how life was framed. If you ask someone, what their career was again in say 2018, well, before Katrina, which is almost 2 decades prior, I did this. After Katrina, I did that. In other food research that I did, well, before Katrina, I ate this type of food. But then I was displaced and lived in this community after Katrina. And this happened to my diet. I got healthier. But then I went back to New Orleans and I ended up having the same health outcomes as before Katrina. And so this tells us something powerful. This isn't just about remembering a storm, it's about trauma. A single event that permanently reshaped how people experience their environment, their sense of security, and even their identity and their behaviors. It's climate mental health in real time. We often talk about hurricanes and extreme weather as these singular moments, but the mental health impacts don't end when the floodwaters recede. The uncertainty, the displacement, and a long, inequitable recovery process creates lasting emotional burdens. And through our Voice NOLA, we used digital citizen science to understand how people experience health and well-being in their neighborhoods today. Residents went out, they collected data about their surroundings and documented issues affecting their daily lives. Access to food, transportation, safety, and green space. And what we found was that so many of these concerns overlap and are still shaped by that defining event. And this is why climate response must address mental health. Recovery isn't just about rebuilding structures, it's about restoring stability, community, and well-being. And here's the part that people often overlook. Katrina didn't create these vulnerabilities, it exposed them. Because long before the floodwaters came, the groundwork for environmental inequity, Katrina didn't create these vulnerabilities, it just exposed them. Okay, it had already been laid through redlining long before the floodwaters came. And this isn't just a New Orleans issue, we see it in cities across the country. For example, a 2024 study by Estienne and colleagues examined how historical redlining has led to persistent environmental disparities in predominantly Black, Hispanic, and other marginalized communities across California. By integrating historical maps with contemporary environmental hazard data, the researchers found that formerly redlined neighborhoods experience higher pollution, more noise, less vegetation, and elevated temperatures compared to those non-redlined communities. And so these are not abstract issues. They're why, during heat waves, for example, some neighborhoods are 10 degrees hotter than others. In 2023, the US saw a record-breaking $28 billion weather and climate disasters, more than any year on record. The total cost exceeded $92.9 billion, and Black communities faced disproportionate impacts with heightened exposure to hurricanes, wildfires, fires, flooding, and extreme heat. But the consequences extended beyond physical destruction. Property loss, job instability, and health crises intensify stress and mental health challenges, which makes sense. Like, who could go through that and not be impacted? Okay. This making climate resilience not just an environmental issue, but a public health issue. And so, as we know, Black and Brown communities contribute the least to climate change, but bear the greatest burden from its impacts. And so these disasters don't just cause physical destruction, they also fracture communities, uproot cultural ties, and create lasting emotional and psychological distress. I think of the wildfires in California and the mental health impacts that likely has on the residents that were impacted, but then also those who may be indirectly impacted. And so when we talk about, in general, climate justice is mental health justice. And addressing these inequities means ensuring recovery efforts go beyond rebuilding structures to restoring well-being, stability, and connection. So up to this point, we've looked at how environmental vulnerability isn't just about geography, it's about history, it's about policy, and who has been left unprotected. We've seen how systemic injustices like redlining didn't just shape like where people live, but it exposed how they are to climate risk today, how exposed they are to climate risk today. And when disasters strike, the damage isn't just physical, it's about who has the resources to recover, and as I mentioned earlier, who is left waiting. But there's another layer to this that doesn't always get the same attention, because climate change isn't just about reshaping landscapes, it's about reshaping how people feel, how they process the world around them, and how they navigate daily life. And so this brings us to something just as urgent as infrastructure and policy, climate mental health. And this is where we have to begin to expand the conversation, because the impact of climate change isn't just about what we see, okay? The flooded streets, the lost homes, the destroyed neighborhoods. It's also about what we carry, the grief, the anxiety. Even thinking about the anxiety I had for my father whenever he was near a body of water, okay? The sense of instability that does not just disappear when the water recedes. Beyond displacement, the mental health impact of climate change is often overlooked. It's still considered in an emerging space. But oftentimes, Black and Brown voices are not at the table in these discussions. Oftentimes, when I'm in these discussions, it's just me. I'm the representative, okay? When it comes to climate mental health. But I know that there are others in this space, okay? Because climate mental health, or the mental health implications of climate change, affects our well-being in profound ways. Disasters like hurricanes, wildfires, I've already mentioned, they cause grief, trauma, and anxiety. Again, whether people experience them firsthand or watch their communities suffer, right? And what we've seen is that survivors in hurricane-affected areas, for example, have higher rates of depression and anxiety. But these emotions are not signs of mental illness. I do want to stress that. They are a natural response to real escalating threats, okay? They are rational thoughts, or a rational response. And so for communities of color, especially those in low-income areas, barriers to mental health care are significant and become even more critical after climate disasters. And so climate justice must include mental health support and ensure equitable access to care for those that are most impacted. Now, researchers, including myself, use various terms to describe the emotional and psychological impacts of climate change. Now, you've probably heard me say climate emotions, climate anxiety. Later on in the presentation, you'll hear eco-emotions and eco-anxiety, maybe even eco-distress. But these, again, I'll use them interchangeably, but they capture worry, they capture fear and anxiety about environmental degradation. Whereas climate grief, eco-grief, and ecological grief reflect despair over ecological losses like that a community may have, all right? So just always get this. Solastalgia refers to distress from witnessing environmental changes in one's community, such as wildfires or rising waters. And so through these emotions, we acknowledge that they vary in intensity from mild to severe, okay? But again, they are natural and rational responses. And so I really can't stress that enough. However, when distress becomes overwhelming, it can disrupt mental health well-being. It can disrupt decision-making and the things that you do in your daily life, okay? And so when you compound this with existing inequities. But before I kind of go into that, I do want to share that my colleagues at the Climate Mental Health Network developed the Climate Emotions Wheel. It's in 30 different languages, and it's a tool to help name and validate those feelings, okay? So this is one of many resources that are made available through the Climate Mental Health Network, and I encourage you all to tap into that resource. But now I want to kind of go through the data so you can understand the extent to which certain subgroups of the population are impacted by climate mental health. So what we've seen is that young people seem to be particularly vulnerable to the psychological impacts of climate change. For example, a 2020 American Psychiatric Association poll of US adults found that 67% of Gen Zers, those are individuals aged 18 to 23 years, and 63% of millennials aged 24 to 39 years are somewhat or very concerned about the impact of climate change on their mental health. This work also found that the concern cuts across all races, ethnicities, and genders. In a 2021 large-scale global survey conducted with 10,000 youth ages 16 to 24 from 10 different countries, including the United States, found that 59% of adolescents and young adults reported feeling very or extremely worried about climate change. And over 45% reported that this worry impacts their daily lives, whether it could be their sleep, just concentration, and overall mental well-being. The Yale program on climate change communication found that 57% of African Americans are alarmed or concerned about climate change, which is higher than the 49% of white respondents. They also found that among Hispanic Latino adults, Black Americans, and younger generations, so like Gen Z, millennials, and Gen X, they're the most likely to experience anxiety, depression, and distress related to climate change. And despite this heightened awareness, systemic barriers often limit policymaking and resource allocation engagement. Concerns about climate change have begun to shape major life decisions among young people, including where they live, what careers they pursue, and whether or not they plan to have children. In 2024, my colleague Jade Sasser, who was also an advisor to the Climate Mental Health Network, and Emily Merchant, further confirmed that race plays a pivotal role in climate-related emotions. In a study of about 2,500 participants in the United States between the ages of 22 and 35, non-white respondents were more likely than white respondents to feel traumatized by climate change, adjust family planning due to climate-related emotions, and express both greater hope and optimism about future and raising children in a changing climate. These studies that I've mentioned highlight the fact that climate change impacts our mental health, shapes our attitudes, beliefs, and behaviors, with some groups being impacted more than others. But then an area that I'm interested in is learning more about what those differences are and what those mechanisms, what mechanisms exist. And so I want to pause here for a minute. And one of the questions that I've constantly had is, how do Black communities even talk about these feelings? Do we use terms like eco-emotions and climate anxiety, outside of professional space? I don't. Or is it mixed into the broader challenges that we face? Housing insecurity, police violence, or economic stress, or even food insecurity. How do we even describe the emotional weight of climate change when it's compounded by systemic racism, economic instability, and historical traumas? So for many Black people, conversations about the environment don't really happen in isolation. They're wrapped up in conversations about health disparities, systemic racism, and economic inequities. In a landscape review of the literature and nearly a dozen interviews with climate psychologists and experts, my colleagues and I at Sea Change Institute and the Climate Mental Health Network found that for many youth of color, concerns about climate change are deeply interconnected with other issues affecting the everyday lives of Black communities, ranging from, I mentioned them in the last slide, but racism to violence and so forth. A simple way to illustrate this is through a conversation or interview that I had with Jacqueline Patterson, who, if I'm not mistaken, is presenting at this conference. What I learned in interviewing her for this particular report is that she often cites the late Audre Lorde's 1982 insight. There is no such thing as a single issue struggle because we do not live single issue lives. So recognizing these compounded and emotional burdens is the first step to addressing them. It's less, I'm anxious about climate change, and more, I'm concerned about how I'll pay rent after this flood, or I'm worried about my child's asthma with all this pollution. What we face as in our Black and Brown communities is double jeopardy. It's the brunt of climate change and systemic racism and inequities. And all of this, the same communities are told to be resilient. And while we should, it's important to note that resilience is complex. The American Psychological Association defines resilience as the process and outcome of successfully adapting to difficult or challenging life experiences. But when the media called Hurricane Katrina survivors resilient, it often overlooked the systemic failures that forced that resilience to be necessary in the first place. So what does it mean when resilience becomes code for, keep surviving despite everything stacked against you? Why is it that people most impacted or affected by structural neglect are the ones expected to bounce back? Bouncing back can be difficult when, in addition to inadequate resources and support, due to a range of individual to societal level and policy level factors, your mental health is impacted. Dr. Robert Bullard reminds us, people are saying we have to make our communities more climate resilient, but it has to be a resilience that cuts across race, class, and geography. Resilience should not be about communities having to deal with adversity. It should be about addressing the systems that make them vulnerable in the first place. And so this is something that I talk a lot about with my students. It's like, let's get to the root cause, okay? We have to work upstream solutions. Oftentimes we're situated in our, work, working, operating downstream. But if we really want to make changes upstream, but we have to acknowledge that it's like a continuum. So there's something that has to be done at all the levels. And so climate mental health isn't just about personal resilience. Black communities don't need more lessons on survival. I think we can check that, okay? The real question is, how do we ensure climate conversations reflect the lived realities of Black life? How do we move beyond individual coping strategies to address the structural conditions that fuel climate distress? When we talk about environmental justice, we must also talk about economic justice, health equity, and racial justice. Climate anxiety in Black communities does not exist in a vacuum. It's layered onto longstanding disparities across sectors. And if we truly want to support climate mental health, we have to shift the conversation from resilience to transformation, ensuring that solutions don't just ask people to endure, but work to change the conditions that make endurance necessary. Again, focusing more upstream. Research indicates that hope and resilience are both stable psychological traits that can act as protective factors against adversity. In some of the recent climate work that I've been doing, there's a debate about hope, resilience, optimism. But if resilience alone isn't enough, what keeps people fighting for change? What drives action, even when the odds feel stacked against us? I think it's hope, because resilience without hope is just survival. But hope transforms resilience into action. And that's where hope comes in. But what do we really mean when we talk about hope? And is it the same as being optimistic? So I'll start with the optimism first. Okay, optimism assumes that things will get better, right? It's passive. It's an expectation that the future will just, work itself out, that technology will save us, that politicians will finally do the right thing, that the tides will turn in our favor. Or states that optimism leans back, puts its feet up, and wears a confident look. That being said, optimism can lead to inaction. It makes us believe that change will happen without us, that we can wait for the right moment, the right leader, the right breakthrough. And Black communities that have seen promises broken over and over, don't always have the privilege of being optimistic. So when people say I'm not optimistic about the future, it's not necessarily because they don't care, it's because they know that optimism alone won't save us. So optimism is important, but we've gotta act. Hope is different. The late Archbishop Desmond Tutu once said that hope is being able to see that there is light despite all of the darkness. But he didn't stop there because hope is also knowing that we are the ones who must carry that light forward. That being said, hope doesn't assume things will get better. It insists that they can, but only if we make them. Hope, as Howard Frumkin explains in Hope, Health, and the Climate Crisis, is active. It is not passive. Hope is what keeps people in Flint fighting for clean water, even after a decade of broken promises. Hope is what keeps Black farmers reclaiming land and building food sovereignty, even in the face of economic injustice. Hope is what keeps young people showing up in the streets, organizing for a climate future that they may not ever see in their lifetime. And hope is a mental health strategy. Psychologists studying climate anxiety have found that hope is one of the strongest protective factors against despair. It gives people a sense of control, a sense of purpose. It shifts from passive despair to active engagement. So when we talk about mental health and climate change, we have to ask, how do we create conditions where hope is possible? Hope is more than just an individual mindset. It must be supported at every level of society. So when I talk about downstream versus upstream, I'm getting a bit more into it now, okay? So hope turns into action when people have support, communities are strong, and systems create the conditions for change rather than just expecting individuals to push through adversity. The social ecological model is my favorite model or theory. It's really how I see the world, how I see every problem that I work to solve, all my complex problems. I look at it through this lens. And it helps us understand, in this instance, how climate mental health is shaped, not just by our individual or personal choices, but by our relationships, our communities, our institutions, and policies. Okay? And I'd like to say that even through this, there's this cross-cutting thread across each of these levels for racism, and discrimination. As part of our landscape analysis that I referenced earlier with Sea Change Institute and the Climate Mental Health Network, we identified 7 core intervention strategies to address the mental health impacts of climate change. These evidence-based approaches range from emotional coping tools to climate action. And we saw these as the most promising of the interventions that we saw in our review of the literature. They offer pathways for fostering connection, sustaining hope, excuse me, and supporting well-being. Hope fuels meaningful change, but again, it must be supported, not just expected. Resilience is a strength. And again, Black communities, we've always been resilient. We've had no other choice but to be resilient. But again, resilience alone should not be the only answer. And it can be exhausting when systems fail to provide real solutions. I know many of you are tired. I'm tired, okay? And so each of these strategies plays a role at different levels of the social ecological model, from individual self-care to community-led initiatives and policy solutions. And so what I've done is I've embedded these promising interventions or approaches rather across all the levels of the social ecological model to ensure that resilience is not just about enduring hardship, but about transforming systems to create real sustainable change. And so at the individual level, research shows that hope, especially hope tied to action, reduces hopelessness. But action doesn't always mean protest or organizing. Sometimes it means self-care, resting, grieving, and making space to process emotions without the pressure to fight. That's why acknowledging and validating feelings is the first step. Climate distress is real. It's a rational response to a crisis, and no one should bear it alone. And so we need spaces where these emotions can be expressed, understood, and channeled. and not just into activism, but into healing, storytelling, or simply making it through the day. Emotional coping tools like reframing, mindfulness, so just being in the moment and finding meaning can help us manage distress without carrying the full weight of the world. At the interpersonal level, we look at social connection, okay? Climate distress often creates a sense of isolation, but research shows that strong social ties, whether among friends, family, or activist networks, these are the best buffers against anxiety and depression. This is why groups like Outdoor Afro, which I engaged with when I lived in the San Francisco Bay Area, as well as the National Black Wellness Collective and Black to the Land are so important. They're not just about access to green spaces. They're about creating spaces where people can heal, reconnect with nature, and see themselves in environmental narratives. Because climate distress isn't just about what's lost, it's about what's worth fighting for. So we've talked about how climate distress isn't just an individual experience. It's shaped by communities, histories, and spaces that we have access to, but also the solutions that exist. And they're often rooted in the same places where harm has occurred. And so one of the most overlooked yet powerful climate mental health strategies, again, is connecting with nature, particularly Black communities historically excluded from green spaces. And again, that's where initiatives like Black to the Land come in. I engaged with them through the, introduced to them and began working with them through a program at Thriving Earth Exchange. And so this is more than an outdoor program. It's a movement that combines environmental justice, mental health, and cultural reconnection. And so I encourage you all to look into this resource. One of the things that I've done as we think about individuals and working with communities, and I'll tap more into community in just a second, is that it's being part of the co-creation process. And so this is the book chapter that I referenced earlier. And so my community partners at Black to the Land are co-authors in this. So in the work that we do, it's important to co-create and involve those who we work with in our work. And so getting more at the community level, connecting with nature is a powerful but often overlooked tool for climate mental health. Many people say time outdoors helps manage climate anxiety, yet access to green spaces can remain deeply inequitable, as we've talked about previously, okay? And so, but climate action itself is also an intervention, and research shows that activism, whether it's through organizing, mutual aid, or advocacy, reduces feelings of helplessness and strengthens resilience. The challenge isn't convincing Black communities to care about climate change, because we already do. We have a whole conference here that speaks to that, okay? The real issue is resourcing the work that's already happening, all right? We don't need more reports on vulnerability. We need funding, policy support, and visibility for Black-led solutions. I'm going to tell you a quick story. I am cognizant of time, and I think I've received a couple of messages. Just give me a few more minutes. But let me tell you this story. In a public space, there was a large white box painted on the ground. People avoided stepping on it, assuming that it had purpose. Maybe it was important, a safety marker, a warning, who knows? Year after year, it remained untouched. But when someone finally asked why it was there, the answer was surprising. No one even knew. The original reason had been forgotten, yet people kept obeying the invisible rule, treating it as if it was something sacred, when in reality it meant nothing. This is what happens when outdated policies and systems are present. We inherit them, we follow them, and rarely stop to ask, do they still serve a purpose? We see this disaster and relief systems that repeatedly fail the same communities. In mental health care, that remains disconnected from climate justice and the assumptions about who deserves resources and who's left behind. But what if we approach these systems differently? Instead of blindly accepting barriers, what if we expose them, question them, and build something better? What if we made climate mental health a priority and not an afterthought? What if we ensured that disaster relief didn't just rebuild communities, but strengthened them for our future? And so at the institutional level and policy level, and I'll close, Black communities don't just face environmental hazards, we face the structural neglect, okay? We can't afford to keep seeing climate justice as separate from issues like housing discrimination, education, and healthcare, and so forth. Institutions from universities to healthcare systems must recognize that addressing climate distress isn't just about mental health resources, but about making sure our communities aren't repeatedly placed in harm's way. Hope must be built into policy, ensuring that access to mental health care, green spaces, disaster relief, all the things that I've spoken about today, okay? Social connection matters and fund community-led initiatives, mutual aid networks, and resilience hubs. Mental health must be a part of climate planning with trauma-informed care and long-term support. Invest in historically underfunded communities to reduce climate risk. Shift from crisis response to prevention, support communities before disasters strike. Accountability is key, where we address the legacy of disinvestment and environmental neglect for lasting resilience. So the fight for climate justice is not about convincing Black communities to care. We already do. The real question is, how do we make space for action when survival itself is exhausting? The burden of this crisis should not fall on us alone, but if history has taught us anything, it's that we can organize, we can reshape the world. And that time to reshape is now. So I'll post my presentation in the app. I have recommendations of what can be done. I do encourage you all to just take a deep breath, take in the things that I've provided here, and please reach out to me, jsheats@tulane.edu, if you would like to connect. Thank you.
Hi, Dr. Sheets. We have some questions
Okay.
that we would love to have your feedback on. The first question that I have here is, what have you seen work with regards to connecting with communities of color with the inherent duty to be stewards in their environments, regardless of ownership?
Yeah, so, and I can actually speak to some of the work that Black to the Land, and there are two different Black to the Land organizations, and I think they're both maybe located in the Bay Area. The one that I worked with was founded by Zappa Montag, and they identified a plot of land, I think it's called the Emerald Earth. And so what they aimed to do was to kind of work with young people and to get a sense of, whether it was through informal conversations or survey, to get an understanding of, the amount of time that they get to spend outdoors, how they feel when they're outdoors, getting a sense of their family. So just kind of talking to the audience that they wanted to engage with. Oftentimes we create solutions where the people that we want to impact are not part of creating that solutions. And so when doing that, we can get a sense of what barriers, what interests are, what factors play a role in getting people outside and getting people to be stewards and care for the land. And so with this particular organization, they collected that data, and it's actually some of the data are shared in that book chapter that I mentioned. But they use that data to create a solution, to bring people into a space so they could understand the importance of environmental stewardship, but then also want to care for the land and be engaged with the land and spend time outdoors. And so I think they're still building on this, but that was just one element. So I'd say engaging with the population you're interested in understanding their barriers, their needs, their wants, and what environmental stewardship means to them.
Thank you. Thank you so much for sharing. Our next question is, this person wants you to talk a little more about the resilience piece. Where can we find the day-to-day inspiration to keep going?
Well, it comes out in that model that I presented, those pathways to climate health and collective well-being. I mean, I think some of those strategies, whether it is one, acknowledging and validating your feelings, social connection, connecting with nature, self-care, these are things, strategies rather, that can help move us forward. And I want to say, keep us encouraged, because anytime I do a talk around climate, I always have to open with some kind of like calming exercise, because it makes me sad, it makes me angry, it makes me frustrated. All these emotions kind of come up. So I totally understand where it's like, how do we remain resilient when all this is, put upon us, all these barriers, all these upstream factors that are impacting us. And so I think, as I mentioned, and again, I'll make sure that you all have access to this, it's really tapping into some of those coping, those promising strategies, I think is a good first start.
Thank you. Can you talk more about the connections between climate justice, gentrification, and mental health? And this person shares that as a native of New Orleans, I'm in a constant battle of being happy to see improvements in the city and being angry that the improvements only come with gentrification or big events like the Super Bowl.
Yes, yes. When I moved back to New Orleans in 2016, I lived downtown, and after maybe a year, I was like, this could be any town, any town USA. I lived in a high rise, and living there previously, I knew what the culture of New Orleans felt like, and I understand there was a shift in that culture after Hurricane Katrina, but it almost made me sad. And so I then relocated into a historic neighborhood, and I felt more connected to the city because of that. In the research that I had done in Our Voice NOLA, gentrification was a major factor that community residents, or we call them citizen scientists, felt that impacted their health and well-being. They felt that bringing bringing people from all over, whether it's like, people that move from other places or just the whole Airbnb situation at that time, like they felt like they didn't feel safe. It was a time when they could go out in their communities and walk freely and know everyone's name. Okay. But in some communities, I think that it was one of my participants near the Bywater, they were scared. They didn't go outside as much anymore because of gentrification. And some of the data that participants collected for that particular study were images and audio narratives about the impacts of gentrification. And so reading your question, I feel that it does have a huge role because there's so many different layers to climate and to justice. And so to the point where, again, same thing is happening. Only certain communities are reaping the benefits of some of these like climate solutions as a result of big events or gentrification. And so it's like, well, why couldn't we get this from the start? So there's definitely, a relationship there. It's something that, we have to be aware of. And it really comes down to getting at some of those root causes and ensuring that you're at the table as well as other people are at the table in these conversations. And I'll say at the table and being heard.
Being heard is the key point,
Yeah,
right?
it's like you can sit at the table all day long, but if they don't hear you or value you in your lived experience or expertise, then it's not impactful.
We have another attendee who was wondering if you could speak toward how best to create an open, welcoming space for building relationships with people who are neurodivergent. And then, is there a way we should go about educating neurotypical people towards creating those spaces?
So again, I am not a psychologist, I'm not a neurologist, a neuroscientist, but what I can say because I've been in a few different conversations about, trying to build community. I think that one thing that can be done just based off these, other conversations that I have, and I think it's still relevant, is identifying some shared values, commonalities. I think that whatever however you categorize yourself, I think that that is a good starting place. Okay, so that would be my recommendation.
Thank you. We have 5 minutes left, but we may be able to get a few more questions. And one question here is climate mental health a regularly used term now, just like climate adaptation or intersectionality?
So, I think, well, in general, climate, exploring the connections between or intersections between climate change and mental health, it is a relatively new space. I mean, there's people that have been, doing this work for a very long time, but it's almost like, and what I found in doing my earlier work with that, the climate change and youth mental health report is that everyone knew each other in that space. So we were able to interview about, around 12 different people, 12 different psychologists in that particular report, and they were all very aware of one another. They'd worked together, they were collaborators. And so I feel that this is still an emerging space. And so that's why I showed that screen earlier. Like, you may hear eco grief, you may hear climate anxiety. I often use climate anxiety as more of like all encompassing term, but there are a range of terms. And I don't think any one term is more popular than the other at this point. But I think that it's something, as more and more attention is placed on this, as more and more research in this space and programs are being funded, then we'll start to hear more. In my work with the, in my work with the Climate Mental Health Network, we've been doing research for the past couple of years, trying to tap into younger populations in schools, and, kind of understand, what resources students need, but then also what resources teachers need. And to better help students in this space. And so I think people just call it something different. I'm thinking about all the interviews that we did with teachers from across the country, and some people just say climate change. So it just really depends.
Thank you. Okay, last question. And I think this person is trying to get how do we convince kind of traditional agencies that are more militaristic that there are underserved communities that do want to participate in their programs?
Yeah, that's a great question. And sometimes I think like the data isn't always enough. But one way that I've been able to really work across sectors and engage with different groups is to tap into storytelling, make it real and make it relevant. Okay, connect it to something that they care about. And in general, climate change as a broad topic is cross-cutting. Like it's across sectors, it impacts everything. And so in regards to climate mental health, it's like one of the approaches that we use for one potential funder was like, if you don't, like, basically you need to get on the bandwagon because there's more and more research in this space. It's growing. Climate change is impacting people's health, access to education, so many things. And so do you really want to be the last one to kind of jump on this bandwagon? And so we've used that approach for a couple funders, and it actually worked.
Thank you so much, Dr. Sheats. Thank you for your time, your wisdom, that beautiful picture of sunflowers where we could take a long, deep breath because we definitely need it.
Yeah.
Thank you so much for being a part of Taking Nature Black. You've left us with so much to learn, and I know many people are excited to see your slides as you post them on Whova. And for everyone, all of these sessions are recorded and they will be posted on Whova probably no later than March 14th. We will put all the recordings up on Whova so that you can access them even if you were not able to see them, so that you don't just have Dr. Sheets' slides. You also have all the wisdom that she shared in this keynote. And I am going to send us to our own take a breath break. We're going to break for about 5 minutes, and we are going to come back at 11:35, where we're going to talk about building flood-wise communities. How do we address flood resilience in our communities and look at organizations that are doing that in DC and Baltimore? And with that, we will see you back here at 11:35. Thank you, everyone. Thank you, Dr. Sheats.
Yes, thank you so much.